Hello, good evening, everyone. Hope I'm audible. Just let me check that. Then we'll start our class of radiology, right? Okay. Just 1 second. Let me open the chat box. One second, guys. I hope we are live now. Just I'm checking that. Okay, perfect. So, good evening, everyone. Welcome to this session of radiology. So, in this session of radiology, what we are going to do is we are going to discuss such topics which have been previously very much asked in our FMG exam. That's the first thing. Second thing is that, see, radiology is a very easy subject, बहुत आसान subject है. But the thing is, with respect to exam, I'm speaking, radiology is actually an easy subject. Okay. So with respect to exam, since it is an easy subject, what exactly we need to know? So basics are very important. Followed by that basics, the next important thing what you must know is differentiation of major important X-rays. That is the first thing. Basics of ultrasound and the named signs which can be seen with your MRI, beat CT and the systemic radiology, right? So this radiology subject, what happens in the context of FMG exam is, so the thing is, see, look here. Now what happens is there are multiple places the subject is going to come, like, for example, all the musculoskeletal system you are going to cover it, even from the radiology, also from your orthopedics. For example, let's talk about urology. All the urological investigations, once again they will come back to you in surgery. For example, ultrasound related, again they'll come back from surgery, and as well as the majority from OB-GYN. Okay, so these are very easy to understand. Let's start with the radiation itself. My dear students, when we are speaking of radiation, the first and most important basic what one must know is see, whenever we are speaking of radiation, so it's basically a type of light. So the light will have different types of wavelengths, and also it has a property of either being a ionizing radiation or being a non-ionizing radiation. So all the radiation can be classified based on ionizing property and non-ionizing. So what exactly is this ionizing? Ionizing radiation, whenever it passes through something, it will create somebody called as a free radicals. It will create somebody called as free radicals. One of the most important point to be remembered is what is that? Ionizing radiation, when it passes through a cell, will create what is that? Very importantly, free radical. But non-ionizing radiation, they do not create a free radical. So that is why they can be safely considered in children and as well as in the pregnancy also. Okay, so non-ionizing radiation includes sound waves, okay, magnetic waves and electromagnetic waves and a normal plane light. So ionizing radiation will have rays such as X-rays, alpha rays, gamma rays and UV rays, even your beta rays. All of them comes under what is that? Ionizing radiation. So please understand, whenever we are speaking of large amount of radiation exposure, so what happens, radiation can have a one powerful effect, that is it can cause hydrolysis of water. So ionizing radiation can do what? It can even do hydrolysis of water, means basically it will break down the water into hydrogen and OH ions. So this OH is a type of free radical which can interact with the cell substances such as beat lipids, beat proteins, beat a genetic material, with anything it can interact. So one of the most important fact to be remembered is all the ionizing radiation are harmful to the body when compared to that of non-ionizing radiation. So both are harmful, but one is very harmful. Which is very harmful? Very good. Ionizing radiation. Ionizing radiation, right? So please understand, all these above mentioned ionizing radiation should be avoided in the children pregnancy, right? So most radio resistant cell of human body, this is a very favorite question of examiner which was asked. What do I mean by radio resistant? So radio resistance means whenever that, whatever the particular radiation, be it ionizing, non, whenever radiation passes through some cell, so the cell can have a damage or some sort of changes inside the cell. So the most radio resistance means when these type of cells, most importantly, that is your fibroblast, that is your fibroblast. So fibroblast is the most radio resistance. After that comes your bone. And radio sensitive places. So radio sensitive organs, please remember one of the most important organ is your gonads. What is that? Gonads. Okay. So gonads are what? They are your radio sensitive organs. Okay. So in the ionizing radiation, let's start with the first type of radiation. That is, my dear students, it is your X-ray, right? So when we're speaking of X-ray, it is a widely used investigation. So for example, we do X-ray. First, let me give you an introduction of X-ray. How exactly, where exactly we use it, okay? So most of the time for the bone tissue, whatever there is a damage in the bone tissue, to analyze that, which rays are used? X-rays are used. Along with that, for the chest also, one of the widely used investigation is your X-ray only. So when we are speaking of X-ray, it is a type of, we can call it as projectional radiography. For example, look here. So I have a image generator. So I have this X-ray image. How exactly I will get the X-ray image? Let's understand. So we will have X-ray generator, my dear students. What is that? X-ray generator. So this X-ray generator machine will create the X-rays. That X-rays will pass through the body, and later we are going to get an image like this. So this is only your, what is that? X-ray technique. But how exactly, what exactly present inside that X-ray generator, we'll understand in a minute. Very simple. Consider, so there is a X-ray machine. So I am standing here, X-rays will come and fall on me, and they will pass through my body and create an image. Okay. So X-rays are generated most of the time by a machine called as X-ray tube. We call it as a X-ray tube, and wherever the X-ray image is created, usually we'll call it as a cassette. So there are two things. What is that? The image creation or the radiation detection occurs in a cassette. So again, many students are confused. Let's understand. This is one object. There is one object. Okay. Now here I will have X-ray generator. So this generator will send the X-rays, and that will fall on something called as cassette. So these X-rays depends upon the object. Some X-rays will pass through it, some X-rays will not pass through it. Based on how much X-rays will go and fall on the cassette, based on that we are going to create, what is that? Image, my dear students. So this X-ray tube itself, let's understand, right? So the X-ray tube consists of this particularly easy thing to understand. The basic two electrodes are present. What are the two electrodes which are present? We have a cathode, and my dear students, we have a anode arm. So there are two types. Cathode arm is there, anode arm is there. So cathode arm is basically is a negatively charged electrode. So basically electrode that is negatively charged electrode is cathode, and the other side we will have, my dear students, we will have a anode. So there are two things placed like this, one against each other. Cathode, anode. Both of them are sitting there. Now, from this cathode, what will happen, my dear students? Whenever I give electricity from the cathode, so electrons will start to come out. What will start to come out? Electrons. So the electrons which come out from the cathode, they will go and fall upon your, what is that? Anode. So from the anode, what will happen? X-rays will start to come out. So when electrons fall on the anode arm, so what will generate? X-rays will be generated. So when electrons fall here, so there will be some nuclear level reaction. Which will create, what is that? X-rays. So basically they'll ask you one question. The anode arm is made out of which metal? It is made out of tungsten. It is made out of what? Tungsten, my dear students. I hope everything is clear so far. So basically two electrodes are there. One is cathode, one is anode. Both of them are placed against each other like this. From the cathode, electrons will come. All the electrons, bam, fall on what? Fall on your anode. As soon as they fall on the anode, some reaction occurs inside your, what is that? Inside the nucleus of the tungsten, and also on the orbits, creating a X-ray. Now X-rays will come out, right? So if all of this is placed inside a glass, all of this outside material, all of this setup is placed inside a glass tube, and this glass tube will allow the X-rays to come out. So all this glass is made out of a material called as a beryllium. Made out of what? Beryllium. The place where X-rays are coming out, so that area is not a thick but very thin area. We will call that as a window of the X-ray tube. So this window area will have thin coating of what is that? That is your glass. All other area, the glass will be what? Very thick glass. Okay. Now thick glass will be there, and there will be thin area where X-rays are coming out. That area we call it as a window. We call it as a window. So please understand, through that window X-rays will come out. So there is one important aspect. What is that? At the level of nucleus there is a reaction, I told you people, right? So what is that reaction? If electrons falls, टंगस्टन के अंदर inside tungsten कुछ होता है. क्या होता है? What is that called as? Called as Bremstang's reaction. There will be something called as Bremstang's reaction. Because of this Bremstang reaction, there is a generation of X-rays. Okay, so ऐसे कुछ भी मतलब you take any material and put electrons into it and I will generate X-ray. No, it is not like that. Because of there is a reaction. कौन सा? What is that? Repeat. Bremstang reaction. Because of that, what is going to happen? X-rays will be generated. So once X-rays are generated, see, look here, X-rays are coming out. X-rays are coming out, but they're going into all different directions. So what happens? Let's see. So from the X-ray tube, what happens? All the X-rays are coming. So X-rays can get scattered, my dear students. What can happen to X-rays? They can get scattered. They can go everywhere. So if they go everywhere, absolutely useless. Why absolutely useless? Because if X-rays start to spread everywhere, that can damage the people surrounding. So we need to make sure that the spreading is minimal, right? So wherever our target is there, wherever our object is there, to that direction X-ray has to go. So for that only, we need to avoid the X-rays getting scattered everywhere. To avoid that, what we are going to use, my dear students, called as a collimation. What is that? Collimation. So collimation is done by this setup called as collimator. What is that called as? Collimator. Collimator will do what? Prevents the scattering of X-rays. So this collimator is made out of a material called as lead. It is made out of a material called as lead. So this lead made collimator will absorb all the, see, X-ray was going in this direction, wrongly it was going in different. So if it tries to goes in a different direction, that lead will absorb all the X-rays. Remember, lead has a property to absorb all the radiation. That is a very important thing. So you might have seen, you might have thinking about this. So that is why we have, that is your lead coated aprons are used inside of what? Used inside of the X-ray rooms. In the X-ray rooms, people will wear the aprons which is coated with the lead. So even some X-rays comes out, if it falls, that will be absorbed by your lead coated, what is that? Lead coated apron. So understand very importantly, my dear students, that collimation will prevent the scattering of X-rays in all the direction. Only in this area gap, whatever was there, right? That focused X-ray will come. Now the next important point I want you to understand is penetration ability. What is that? Penetration ability. Sir, what do you mean by this? A very simple way to understand. What happens, my dear students? Please understand. So I have one X-ray coming out like this. One ray, another X-ray, another X-ray, another X-ray, right? All of them have a different ability to penetrate. So some X-rays can penetrate very easily. Some X-rays will not penetrate the objects easily because there are weak rays. Okay. Now, what do I mean by this? For example, imagine I have one human standing here, right? On this human, I have one X-ray which is able to penetrate and go out. That is option A. Then there is, let's take one more ray, for example. It will fall in the human and it will just get absorbed inside the human. So this is your second one. So now when we are doing of X-ray, please understand, only useful one is A. Only useful ray is A, because it is penetrating and going to the other side. If it penetrates and go to the other side, only then my cassette will be able to take that X-ray and create a image. So if it cannot penetrate, absolutely it will come and sit in the body. It will damage the human body. Apart from that, it is not greatly useful. So absolutely useless one will become which one? B. Why? Because it is inability to penetrate. If it is not able to penetrate, sir, what will happen? It will sit in the human only, creating a damage. So we need the X-rays which can penetrate the object. So only those can make the image. So for those of you who are weak at radiology, so remember one thing: if X-ray penetrates, only image can be created. If X-rays does not penetrate, it will not be useful for us. So that is why we need to remove all the weak or non-penetrable rays. So for that only we have absorbers. For that only we have what is that? Absorber. These absorbers will do what? So absorb all the weak X-rays, and all the weak X-rays after it has absorbed only which has a penetration power will cross the aluminum absorber, and here will be our human patient, right? So patient is the object. Let's consider now through the human X-rays will pass and it will fall on a detector or a cassette. Once it falls on a detector or a cassette, it will create what is that? A image. So that will help us understand what is going on in the human body. So whenever X-rays are generated, most important MCQs, quickly listen to me. Glass is made out of beryllium. X-rays come out from thin window. Then the next question is the anode is made out of tungsten. What is the reaction which is occurring? Bremstein's reaction. What is the collimator made out of? It is made out of lead and it will absorb all the radiation. So the non-penetrable X-rays, which are weak X-rays, which can go out of the, which cannot go out of the human body, are not useful for us. They should come, fall, penetrate, go out to the other side. Only then I will be able to make a image. Only then I will be able to make a image. So that is why I require what is that? Aluminum absorber, which removes all the X-rays, which is not able to penetrate. And the next important, the last one will be, so the X-rays will pass through the object, will come and fall on the cassette, that will create an image. So that is the story of your generation of X-rays. Clear? So collimator is made out of what? Lead. This has been previously asked question. Be careful. So collimation is made out of what? Lead. So detector is what? What is that detector? That is cassette. Cassette helps to form the image. So this cassette will have one of the most important substance called as AgBr, silver bromide. What is it made out of? Silver bromide. Now the silver bromide, sir, is a very interesting for you to understand. Listen to me. For example, let's take this is one X-ray. Let's take what is that? This is one cassette. Okay. Now this cassette, my dear student, is fully made out of what is that? Silver bromide. It is made out of silver bromide. So something like this it was sitting. Okay. Silver bromide. Okay. Now imagine two areas. This is let's divide it into multiple quadrants. Okay. Let's call it as quadrant A, quadrant B, quadrant C, quadrant D. Right? So after this, understand, wherever X-rays are there, X-rays are falling on the human body. Wherever X-rays are falling on the human body, they will penetrate and they will go to the others. Where will they fall? On the cassette. On the cassette, what is created? Image. So if image is created, what you need to do? The area where X-rays are falling, that area will turn. What is that? Black. That area will turn into which color? Black. Okay. So if any object, see, rule is very simple. If any object passes the body and goes and falls on the what? On the cassette, that area will turn black. The place where X-rays are falling, that area will turn. Where the X-rays are not falling, that will remain white like this only. So there are two important aspects to understand. So slight, wherever exposure is there, it will allow black color. Wherever exposure is not there, what will be there? There will be white color. So this is a very important point to be remembered. So that is your exposed and non-exposed areas. Okay. So once we understood about, let's continue to the next important aspect. So that will help us understand what exactly is the image. Okay. So what is the image? Image is very simple to understand. So X-ray, if based on how much amount of X-rays are falling, based on that we can have a different type of images. So what exactly? So if the air is there, possibility 1. If bone is there, possibility 2. The possibility number 3 is what? Very important. That is soft tissue is there. They have different penetration capability. So that is only your, what is that? So that is only your most important aspect. That is your, there is no X-rays which are not penetrating. So if they are not penetrating, go. If the X-rays are not penetrating, what will happen? That will area will remain white color. If they are there, that will become black color. So what is there? Based on the ability of penetration. So there are, we have options. Option A is our air is there. Air will allow the penetration of X-ray. Air will create a black color. then possibility is your, what is that, solid bone will be there, right? Bone. So bone will not allow any x-rays to pass. It will create white color. It will create white color. So if it is white on x-ray, it is a bone. If it is air, it will be black color. So that is your story of your, what is that, x-rays. That is the story of your x-rays. Let's continue to the next important concept called as film focus distance. What is that? Film focus distance. So what is this film focus distance? That film focus distance is the distance between the object and the tube. So what do I mean by this? Let's consider. So here I have, what is that, X-ray tube. Here I have, what is that, X-ray tube. So X-ray tube, and here I have a cassette, that is a detector. So the distance between the human, that is your object, right? Human is standing here. So object and the X-ray tube. The distance between these two, object and the X-ray tube, is normally 100 centimeters. Okay, but that will change only and only in one time. What is that? Exception in the chest X-ray. So chest X-ray, we increase the film focus distance up to 180 centimeter, because we can get a wrong interpretation of cardiomegaly. So if film focus distance is very near, we can wrongly interpret the cardiomegaly. To avoid that, we need to look at, what is that? We need to look at the film focus distance. What is that? Film focus distance. So it is more with, what is that, chest X-ray. Okay, it is normal with, what is that, 100 centimeter is normal for any other X-ray. Okay, so let's talk about the position. So position is very important thing. Okay, मैं बात बोलते ही आधे लोगों का दिमाग कहीं और चले जाता है. By position of the patient while taking the X-ray. ठीक है, position of the patient while taking the X-ray, that is a very, very important. Okay, so for that we need to understand two important aspects: positioning of the patient and also view of the X-rays. Okay, so what do I mean by this? Remember, for example, view. What is this view? What is this? Whichever area you need to do the X-ray. So let's imagine chest X-ray. CXR means chest X-ray. Most of the time, the used is PA view. What do I mean by PA view? So please listen to me very carefully. Consider I'm standing like. If X-rays are going from front to back, right? If X-rays are going from front to back, okay, so then I will call it as AP view. Then I'll call it as a AP view. Means X-rays are coming straight, falling and going back. Coming, falling, going back. So we will call it as what? AP view. So X-rays, if go from anterior to posterior, we'll call it as a AP view. Okay, but when we're speaking of other times of the chest X-ray, it is your PA view, that is posterior anterior view. So the X-rays are coming from behind and passing like this. Means X-ray tube is behind me. It will allow the X-rays to pass and it will come like this. Then I will call it as PA view. Okay, most of the lung diseases we prefer which one? PA view. Which one? PA view. Okay, but except for some conditions such as trauma. During trauma, what can happen is damage of your, what is that, damage of your ribs can be there. So to look at the fracture of the ribs, we will use AP view, and all other conditions we will use, what is that, PA view, or maybe dislocation of shoulder joint or something like that. If you want to look also, you'll require, what is that, you'll require a, most importantly, AP view X-ray. Okay, so we can also do lateral with contrast is done for esophagus. Means X-rays. So imagine X-ray tube is here side. So from here X-rays are passing. Then I will call it as lateral view. Right? So usually that lateral view with contrast, which will be utilized for the esophagus to look at the diseases, for example, such as your Achillesea cardia. For example, Achillesea cardia is there. So our Zenker's diverticula, or such kind of things, if it is there, to look at that, we prefer lateral view. We prefer which view? Lateral view. For the bone, we are going to use two views. So one is front to back AP view, and one more is oblique view, because the bone is bones are usually, what is that, multiple places. If it has a fracture, you need to look from the sides, multiple sides. So I will take one oblique view side to side like this, and one is anterior to posterior view. So that is AP view for the bones. Okay, now position of the patient. So whenever patient is able to stand, the best position is a standing position for taking a X-ray. Okay, that is the best position, is standing position. That is only called as erect position, right? So if some people are ICU patients, or for example patients are bedridden patients who is not able to do what, who is not able to do any movements. So that time what do we need, my dear students? We can go for a supine, but which will not give a much details. And there can also be possible, that is your lateral decubitus view. Decubitus view, look here, lateral decubitus, this is the position, and from here I will send the x-rays and they will come out from this side. So that will be called as a decubitus view. So decubitus, which is best for pleural effusion. So this decubitus view, so if I turn to the left side and sleep, I will call it as left lateral decubitus. If I sleep to the right side, I will call it as a right lateral decubitus. So these are the two possible views which can be used for what is that lateral decubitus position. So remember, lateral decubitus is used for majorly for pleural effusion. Sir, what is pleural effusion? Pleural effusion is nothing but accumulation of fluid in the pleural cavity. Accumulation of what in the pleural cavity? Fluid in the pleural. So if there is accumulation of fluid in the pleural cavity, if we imagine I'm standing like this, right? So when I'm standing, for example, fluid is there, all the fluid will come down, right? But if I sleep to a side, all the fluid will come down to one side only. I'll be able to visualize that fluid very clearly. For that purpose only, we are going to go for left lateral or right lateral. So for example, I have left side with pleural effusion patient. So I will ask him to sleep onto the left lateral decubitus and take the x-ray. I'll be able to look at the fluid very clearly. And for example, I have a patient with the right lateral decubitus, right pleural effusion. I'll ask him to sleep to the right side, called as right lateral decubitus. Okay. So I want you to understand there are two parameters we look at. One is, my dear students, KVP, and one more is called as MAS. What is that? MAS. So KVP and MAS, what are these two parameters which are available for our X-ray, and we can actually improvise the image by altering this KVP and MAS. Okay. So what exactly? KVP shows the ability of X-rays to penetrate. Ability of X-rays to penetrate. कितना तेजी से घुस के body से बाहर निकल सकता है. How strongly they can enter the body and penetrate the body. So that is determined majoritarily by your KVP. Majoritarily by your KVP. But when we are looking at MAS, MAS is such a parameter which is helping us identify what is that contrast. Okay. Now contrast, what does it mean and what is KVP? I will explain you better way. Please look here. Please look here. Now, for example, so let's take this particularly this thing. Okay. Now, for example, if I tell you people, this is the area. Okay. So which was fully, which color it was? Fully and a white color. Okay. Fully white color background. Okay. Consider this was a background approximately. Okay. Now this area is also black area. This area is also black area, I can say, right? And this also I can tell it as a black. Both of them are black. But now you will tell what is it? This one will become gray for you, right? So the difference between the black and gray is what? Intensity. Agree with me? So like that only, if more X-rays pass through the body, more X-rays will come and fall on the cassette. If more X-rays is falling on the cassette, that area will turn into black color. That area will turn into black color, which is written as A. So that area will completely turn into black color. Now, for example, inside this black color, let me tell you people. So I have highlighted with full black color. So wherever X-rays are passing, in that area, what is there? In that area, very importantly, what is there? X-rays are falling too much. Now, my dear students, consider I will introduce a bone into this. Okay, consider this is one bone has been added. Okay, if I add one bone here, only in the area where bone is there, that area will look white color because that area is not allowing the X-rays to pass. So in this area will become a bone will become white in color, other area will become black in color. So this will tell me the difference between how intensely black and white is there. We can call it as a contrast. So contrast is what? How clearly you can identify or determine the image, right? So I can do this also, but I can tell here also I can draw one bone, here also I can draw one bone. But if you look here, for both of them, the difference is what? The background is very dark in this side, very dark this side. This is very light back. So the background will tell you the quality of the image because in the body there is a soft tissue, right? There is a, for example, fluids are there, there are bones are there. So each one will create a different intensity of image. So that will help you differentiate to the very dark to very white. So that is only your contrast. So contrast depends upon MAS. MAS means how much amount of photons. X-ray is a rays. The rays will have photons. If more photons fall, the more contrast image you will get. More contrast image you will get. So that is only depends on the time of the beam, left on. Okay, so how long you left the X-rays to fall on. If you leave the X-rays to fall for more longer period on the film, it will turn into black. Okay, so what exactly you need to understand here, the quantity of photons determines the contrast. Quantity of photons determine the contrast, while KVP will increase the penetration. If it increase the penetration, so that is intensity will be altered, but it is what? It is ability for the this thing to penetrate. So if I have a obese patient, I need more X-rays to penetrate, I will use increase KVP. I will increase KVP. Okay, so it is quality of the beam, and here it is the quantity of the photons. So KVP is indirectly proportional to contrast. If you increase KVP, contrast will decrease because more X-rays will start to penetrate. If the more will start to penetrate, you will not have a clear image. Okay, so you need to have such X-rays which will penetrate. But as they penetrate, if they are penetrating more, they will not spare anything. They will pass through everything, and it will create a black color. All right, let's go to the next important X-ray. X-ray, air look black in color, fluid and soft tissue is looking grayish to white in color, and all the bones, my dear students, they look which color? With one of the most interesting image, that is your chest X-ray, my dear students. Okay, so when we are speaking of chest X-ray, let me teach you how a normal chest X-ray looks like. And chest X-ray reading is not something which you learn with one sitting. Actually, by looking at multiple X-rays, the image, like the understanding of X-ray will become easier. Okay, so when you look at a chest X-ray, first the basic thing is what? We know the anatomy. So exactly according to anatomy, we can study. Now look here. So my dear students, we have here, what do we have? Yes, here we have a bone. The name of the bone will be called as clavicle. Name of the bone will be called as clavicle, right? So here also I have one clavicle. Here I have one more clavicle, of course. Now followed by that, I want you to understand this area, whatever is there, right? This full thing. So this full thing is representing the heart. What is that? Heart. That full thing is representing what is that? Heart. So this is the image of your heart in the X-ray. Okay, now followed by that, all these are ribs, right? So within the rib cage, what is there? Lungs are there. So this black color area, whatever you can see, that black color area is your lungs. That black color area is your lungs. Okay, now followed by that, if you zoom in more, so inside of that black color area, if you can notice, there are very tiny small lines are there. Look here, very tiny small lines. So these small tiny lines, they are telling you that they are the small blood vessels in the lung called as bronchovascular markings. Called as what is that? Bronchovascular markings. So what I'm trying to tell you people is, so this area, whatever these thin lines are there, that is telling you bronchovascular markings. So they are the markings of the blood vessels in the lung. And this area we will call it as hilum of the lung. This area will be called as hilum of the lung. So this one will be called as a hilum of the lung, and these small vascular markings, that is telling you what is there. That is your very good lung tissue is there. Why? Because if lung tissue is there, only then blood vessels will be there. If blood vessels are not visible in the chest X-ray, means small blood vessels are not visible, means vascular markings are not there. That means there is no lung tissue. Maybe lung has been collapsed. So understand, to confirm the lung tissue is properly present in one particular area, it is not just about the black color. Because lung is filled with air, it will look a black color only, but also you should be able to notice these small lines called as bronchovascular marking. If they are missing, that is suggestive of your, what is that? Suggestive of lung tissue being collapsed. So understand, for healthy lung indicator, it is not just a pure black color, but also, my dear students, vascular markings are very important. So we have here we will call it as a aortic arch. So this is the arch of aorta, actually called as aortic shallot. and then this one will be called as a cardiac notch. So this is the area of the cardiac border. And the last but not the least, but very, very important for your exam point of view, that is your angle. Angle of what? Angle of your, that is your costo-diaphragmatic angle. All of us know that. So there is, what is there? Diaphragm is present like this. So above the diaphragm, what is there? Lungs are there. So the line where there is the diaphragm and the chest cavity forming the angle, this angle, my dear students, will be called as a angle, that is costo-diaphragmatic angle, or also called as CP angle, called as CP angle. What is that called as? Costophrenic angle or costo-diaphragmatic angle. So these CP angle, they must be, always remember, they must be sharp in nature. Okay, so if they are not sharp, for example, so there is something like this, all this area was filled with some fluid like this. Now what will be there? There will be blunting of the CP angle. So CP angle, is it sharp? No. If it is not sharp, then we can suggest you of, it may be suggestive of some fluid has been accumulated there. So fluid accumulation will be suggested by blunting of CP angle. While we are speaking of normal should be always sharp. So this is the angle formed between, this is the diaphragm, consider this is the diaphragm, this is the chest cavity, the angle formed, whatever you see on the X-ray like this, will be called as a costophrenic angle or costo-diaphragmatic angle. Costo-diaphragmatic angle called as CP angle, costophrenic angle. Okay, let's go to the next important aspect. Let's understand the importance of what is happening here. So when you look at a chest X-ray, remember the technique, at least for your exam point of view, these three, four things you must see. A for angles. Which angles? Costo-diaphragmatic angles. B for bronchovascular marking. C for cardiac border. These three will guide you through a lot of MCQs. A, B, C. So what is that? A for costo-diaphragmatic angle. B for, what is that? Very good, bronchovascular marking. C for your cardiac borders. If you are able to pick up on all these things, very easy for you to understand many images. Okay, let's look at this image, my dear students. What are the three things at least you must look? A, B, C. A for angles. Let's look at both the angles, here also and here also. In both of these areas, angles are sharp. If angles are sharp, that is telling me that the lung tissue is lung angles are normal. So that is ruling out some fluid accumulation. Let's go to the next important aspect, B for bronchovascular. So when you notice this area, my dear students, I'll mark this area. You can notice in all this area, let's zoom in and see also. Do you find any vascular marking? Look here, very clearly vascular markings are visible here, right? Very clearly they're visible on the right line. But here on the left lung, on the other side, you're not able to see this. What is that? Bronchovascular marking. So that is suggestive of what? Lung tissue has been collapsed. That is suggesting me lung tissue has been collapsed. So first and most important, let's determine. So whenever a radiological image is given, how do you solve it? So whenever you are solving it, I want you to go through these particular steps. So this is what image, what type of investigation? It is a type of X-ray. X-ray of which area? Chest X-ray. So most of the chest X-rays, either AP view or PA view, they will write it most of the time. But if it is not there also, either AP or PA view. So for all the lung diseases, we prefer PA view, except for the traumas, or if there is a history of, what is that? History of trauma or maybe joint injuries, then we can think of AP view X-ray. So here there is an absence of which ones? Bronchovascular marking. And if you notice, my dear students, here, so here first let's compare this complete area. We will call it as what? Mediastinum. We will call it as a mediastinum. Mediastinum is the place what is located? Your heart is situated. Now here what will happen? Please understand. So slightly this mediastinum is also shifting. Why? Because if somebody has an injury to the chest, okay, so because of that penetrating injury, so what will happen? So penetration, some sharp object has penetrated. Now that will tear up the pleural cavity and chest wall. So what will happen? Pleural cavity has a negative pressure. So that will suck all the air inside. So from outside, air is going inside the chest cavity, and that is pushing the lung to the opposite side. That is pushing the lung to the opposite side, and it will also push the heart also to the opposite side. So we call this condition as a pneumothorax. So what is pneumothorax? Pneumothorax occurs as a result of penetrating injury. So there is a negative pressure in the chest which will suck all the air into the chest cavity, which will cause the collapse of the lung, and the lung, so from here air will come, it will put the pressure from this side, all the lung will start to move on to the opposite side. So opposite side, so wherever there is a trauma, what is coming inside? Air has come inside, so because of which it is pushing both the lungs to the healthy side. So there is this phenomenon, we will call it as a shift of mediastinum. So look here, mediastinum is going to the side. So if the mediastinum is going to the side, we will call it as a mediastinal shift. So what and all is present? First thing, there is a absence of vascular markings are not there, that is telling you pneumothorax, and also there is a shift of the mediastinum called as mediastinal to the mediastinal shift to the opposite side, to which what is there? Healthy lung is there. Okay, so whichever side is the trauma, opposite side will be the shift. We will call it as a vascular markings absent condition, called as pneumothorax. But everyone will tell jet black lung. So please don't follow that jet black lung, because lung tissue itself is not there. Okay, that's not jet black lung. That area will look jet black because there is no vascular marking. This area is turning into jet black color, that's it, but not jet black color lung. Okay, so it is not a jet black color lung. Jet black appearance will be there. So this jet black appearance as a result of, what is that? As a result of pneumothorax. Okay, so whenever we have a patient with a pneumothorax, right, so the treatment is very important. So please understand, this is also a very important MCQ which has been previously asked. So please understand immediate treatment. So if you are in a small setup or you are in an emergency, you are going to go for a needle thoracotomy. What you will do, you will take a needle which is having a wide bore, needle, and you place that needle into the chest cavity. Chest cavity. So as soon as, for example, here we were discussing left-sided pneumothorax. So what is there? All the air has come and collapsed. Now I will put one needle somewhere. So if I put the needle, all the air has a tendency to go upwards. So the air will start to escape outside. With the help of putting a wide bore needle, because we need to allow the air to go out. But my dear students, remember the definitive management is always chest tube insertion. What is that? Chest tube insertion. Okay. So when we are speaking of chest tube insertion, what is the use of this chest tube? So it will create a one-way valve. So my dear students, this one-way valve, what will it do? It will allow all the air to go out, but it will not allow the air to come back into the lung. Creating, what is that? Creating a one-way valve. So one-way valve is the most important thing we need to understand here. So the next important, let's understand. So whenever I tell you people, what are the three things? A, B, C, angles. Yes, bronchovascular marking, and C for your, what is that? Cardiac borders. When you look at this, A for angles, my dear students, first this is chest X-ray, this is the left side, and my dear students, this is which side? Right side. Okay, so when you look at this, what is happening? If you notice here on the left side, what is there? Blunting of the CP angle. So if there is a blunting of the CP angle, that means that is clearly telling me that there is some fluid which has accumulated. Okay, there is some fluid which has accumulated. So because of this accumulation of this fluid, that this color, this, what is there? This area is fully filled with the fluid, which will create a white color appearance. So blunt CP angle. Now this fluid will start to push the lung to the opposite side. So whenever fluid accumulates also, it will also cause a mediastinal shift. What is that? Mediastinal shift. So to which side? On the side of hydrothorax or to the opposite side? So mediastinal shift, and as well as your, what is that? That is your blunting of CP angle, suggestive of hydrothorax. So what can cause hydrothorax? Hydrothorax is a fluid accumulation. That fluid accumulation can be caused as a result of multiple things, such as hemothorax, and there is a pleural effusion, and there is a empyema. So I want you to understand all three of these conditions, what exactly happened. Hemothorax is a condition as a result of blunt injury to the chest. So there is some blunt injury to the chest, because of which that will rupture the blood vessel and will cause bleeding inside the chest cavity, creating what is that? Hemothorax. So hemothorax, accumulation of what? Blood. Hemothorax, what is there? Accumulation of blood is there. And remember what is happening here? It is as a result of trauma. That occurs as a result of what? Trauma. Occurs as a result of what is that? Trauma. And pleural effusion, my dear students, that happens as a result of fluid accumulation in the pleural cavity. So